We do not have the luxury of inaction. For the health of our country, we must work together now to prevent a fourth surge.
New for you tonight, while the CDC warns of a fourth wave of the coronavirus pandemic, local doctors say the Northeast is now in the middle of it.
So the big question, how will Connecticut respond? Channel 3 Eyewitness News reporter Matthew Campbell is live now with those answers. Matthew.
Well, Aaron and Mark, as of this moment, the way the state has been operating is the way we're going to navigate this fourth wave. Now that the vaccine is here, Governor Lamont is looking at the virus in a different way.
On the recurring feeling I have of impending doom.
Warning of doom, Rochelle Walensky, the CDC director, makes a passionate plea.
As a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer.
In the last 3 weeks, the Northeast has seen a steady increase in cases. Some can be attributed to the mutations of the virus. In other instances, big parties.
I think there were an awful lot of kids who probably went down to Miami Beach and enjoyed spring break, and I didn't see many people wearing a mask there, and maybe those guys are going to be coming back to Connecticut.
No matter the reason behind the increase, this is a problem Northeast states are facing. The fourth wave comes at a time when the vaccine has been introduced, and Governor Lamont is counting on it.
I think Connecticut, and I think most of the United States is going to manage pretty well just because we're accelerating our vaccination in a big way.
In pre-vaccine times, the daily positivity rate drove the governor's decisions. Now the metrics are hospitalization and death rates. While hospitalizations are at the highest they've been in a month, we may not see a huge spike since the most vulnerable have all had a chance to be vaccinated. That's keeping our state open.
I know we'd have time to change course if we had to. I don't see any need to do that. I think the vaccinations are going to stay ahead of the risk.
We still don't have a majority of adults in the state vaccinated. And of course, we have no vaccine for children yet.
Dr. Sten Vermund is the dean of Yale School of Public Health. He understands the need to tread carefully between the economy reopening and the public's health. But just like the CDC cautions, he says we're not out of the woods.
Mass vaccination, that by far is the most efficient long-term strategy. And in the short term, we need to stay the course with our preventive measures.
And those measures include masks and social distancing. There are 17 states that have lifted the mask mandate. President Biden is urging them to put it back on. Live here in studio, Matthew Campbell, Channel 3 News.
Matthew, thank you very much.